today we are going to learn about the important topic that is vasculitis. Vasculitis, that is the inflammation of the vessel. Okay, there are three kind of vasculitis. Means vasculitis is divided like based on the size of the vessel, like large vessel vasculitis, medium vessel vasculitis, and small vessel vasculitis. There are two types in the large vessel, three type in the medium vessel, and 7 type in the small vessel vasculitis. And that's why total 12 type of vasculitis you have to remember for your exam preparation. That's why I have arranged all this type in this tabular format, so that you can differentiate between each type and you can easily remember all the type of vasculitis, because almost 2 to 3 questions are from the pathology or from the medicine directly asked on this vasculitis. So it is very important to learn the vasculitis. It will be very easy if you learn by this tabular format. Okay, so first of all, large vessel vasculitis. In the large vessel vasculitis we have two kind or two types, like your Takayasu and temporal. Now the first, the Takayasu affect the Asian female less than 40 year age. जो एशियन फीमेल है लेस देन 40 ईयर, इट इज़ अफेक्टेड एंड द मेन वेसल अफेक्टेड हेयर will be your aortic arch and great vessels. You can see here a typical image. There is a narrowing of aortic arch and great vessels, and there is inflammation. Okay, that's why ESR is going to increase. If there is, due to the narrowing of the aortic arch and great vessels in the upper extremity, there will be the weak pulse, and that's why it is also called as a pulseless disease. Okay, the symptoms like fever, night sweat, arthritis, skin nodules, myalgia, and ocular disturbance are also seen. This is typical image, and this is the treatment like glucocorticoid. Okay, now in the temporal, Takayasu affect less than 40 year, but temporal affect female greater than 50 year. Means older females are affected here in the temporal. Here affect the arch of aorta and great vessel, and here affect the carotid artery. The carotid artery is going to affect, there is vasculitis, inflammation of the carotid artery. That's why the symptom like jaw claudication and unilateral headache is going to see here. Also it can lead to the irreversible blindness. There is a granulomatous inflammation. Okay, you can see a typical image of the focal granulomatous inflammation, and there is a unilateral headache. This is carotid artery which is going to affect. Here only ESR is going to increase. Here both ESR and interleukin 6 is increased, and treatment as like glucocorticoid. Along with that, a temporal artery biopsy can be done. It is a pulseless disease, that is Takayasu. The temporal is also called as a giant cell arteritis, because there is granulomatous inflammation and the cells becomes giant due to this inflammation. That's why it is called as a giant cell arteritis, that is temporal, and Takayasu, that is your pulseless. This is two about your large vessel vasculitis. Okay, now we will go towards the medium vessel vasculitis. In the medium vessel vasculitis, you have three classification or three type, you can say, that is your Kawasaki, Berger, and polyarteritis nodosa, that is your PAN. Now you have to remember the bike. So you know the Kawasaki bike, and you know most of the children we have which have toy like bike toy. Almost on all bike toy the Kawasaki logo is there and Kawasaki name is there, although they are not made up of from the Kawasaki, but logo is there. So Kawasaki children, and the bike, if we overspeed the bike, it is going to crash somewhere. So you have to remember for Kawasaki, Asian children less than 4 year, and the mnemonic is crash. Now see for the conjunctivitis, which artery is going to affect here? Coronary artery. You can see here there is a coronary artery involvement, and there will be the coronary artery aneurysm, which rupture and can form thrombus, and it can lead to the death. So this is the typical image. Okay, in the Kawasaki, the coronary artery is going to involve. In the Takayasu, great vessels and aortic arch is going to involve. In the temporal, carotid artery is going to involve. That's why I have made the tabular form, which will help you to remember all the things. Okay, then after the crash, R for rash, A for adenopathy, lymph adenopathy. Okay, that's why this disease is also called as a mucocutaneous lymph node syndrome. Because why? I will tell you. S for strawberry tongue, H for again hand foot disease, means what? There is a edema, erythema all over the hand and foot. That's why mucocutaneous. Adenopathy, that's why lymph node syndrome. So this Kawasaki affecting less than 4 year, crash pneumonic, and it is also called as a mucocutaneous lymph node syndrome. Here the fever will be there greater than 5 days. So you have typical history in the case, that is a question, that is a Asian female 3-year-old, adenopathy, fever greater than 5 year, treated with aspirin, like that questions are there. So the treatment will be the IVIG and aspirin. Now important point you have to remember, in the children usually we don't give the aspirin, but the Kawasaki is the only disease where we have to give the aspirin because it has more benefit than the risk. Okay, now the second one is your Berger syndrome. The Berger or burger, you eat the burger, okay, all this male less than 40 year eat burger, all this male less than 40 year, that is adult young age, use smoking. So this burger, it is mainly due to the tobacco smoking. Okay, due to this tobacco smoking there is a Reynolds phenomena, because there is less supply of the oxygen, there is a Reynolds phenomena, there is a gangrene, and the gangrene unfortunately lead to the amputation of the digit. There is also nodular phlebitis, there is intermittent claudication. So these are all the symptoms of the Berger disease. Okay, now there is a what is going to affect, there is a segmental thrombosis with vein and nerve involvement. Segmental thrombosis vasculitis with nerve and vein involvement, like this. There is a mainly digits are affected, Reynolds phenomena and amputation will going to affect, and treatment will be what? Smoking cessation. So you eat the burger by the finger of your hand, you smoke the cigarette by the finger of your hand again, and you, when you after the smoking you put down cigarette on the floor, then you will be by the by the feet you are to destroy the cigarette. So all is going to hand and foot fingers. That is your Berger disease, which is related to the mainly tobacco smoking. Okay, so there is a segmental thrombosing vasculitis of the distal vessels. Okay, that is your distal vessels. So this is important. Which vessels are involved? Distal vessels are involved. Now the third type, that is the polyarteritis nodosa, or we call it as a PAN. Okay, so PAN also involve the middle age men. This involve the middle age men, and there is a fever, weight loss, malaise, there is a fever, weight loss, malaise and headache. Now in the PAN, name में ही सब कुछ है. PAN means what? All vessels, generally all vessels is involved, but it only spare the pulmonary artery. It spare the pulmonary artery. So almost all renal and visceral vessels are involved here. So that is PAN. Okay, it is HbS positive in 30% cases. There will be the hypertension due to the renal involvement. There is a renal damage and neural dysfunction also there. Cutaneous eruption is also there, and the main feature is GI symptom like your melena and abdominal pain. There is also transmural inflammation with fibrinoid necrosis. There is fibrinoid necrosis. Now here main involvement is your all the visceral vessel, but main involvement is renal vessel. That's why it causes the renal damage. And when we are going to perform the renal arteriogram, on the renal arteriogram we see the string of pearl appearance. You can see here on the renal arteriogram we can see a string of pearl appearance. Means what? Renal microaneurysms and renal vessel spasm is going to see. That is called as a string of pearl appearance. Okay, so Here all vessels is involved, that is a pan, but mainly renal vessel is involved, and here pulmonary artery is not involved. This is main we have to remember, because questions directly ask on this. Okay, here is treatment also a glucocorticoid, or we can give cyclophosphamide. Now pan affect the skin, that is the mnemonic. Pan affect the skin. Skin means what? S for skin, K for kidney, I for intestine, and nerve for N for nerve. What are the skin symptoms? I have already told you, that is a cutaneous eruption. What are the kidney related symptoms? That is the string of pearl appearance, renal microaneurysm, and renal spasm. What are the intestinal symptoms? I already told you, that is the abdominal pain and melena. And what are the nerve like symptoms? That is your neuronal dysfunction. So this is about your polyarteritis nodosa, that is a pan. This is typical image. Now this is done with your great vessel and medium vessel vasculitis. This is very important. You can remember in the tabular form. Now we are going to see about the small vessel vasculitis. In the small vessel vasculitis, we have Behçet, cutaneous small vessel vasculitis, eosinophilic granulomatosis with polyangiitis, immunoglobulin A vasculitis, microscopic polyangiitis, and mixed cryoglobulinemia. These are the 7 kind of your small vessel vasculitis. But don't afraid, it is very easy in this tabular format. You will understand each and everything. Let's see individually. The first one is your Behçet. On the Behçet, you have to remember about HB and BT. Now what is this HB and BT? This HB means it is a HLA-B51 association, that is your H, and B, that is for Behçet. HLA association is there, which is where we have to remember. Now this is seen in the Turkish and Eastern people. You have clear mention in your case like a 51-year Turkish man, that is the Turkish, and this is for Behçet. If hemoglobin is low, we can give the patient BT, blood transfusion. That's why B for Behçet, T for Turkish, H for HLA-B51 association. Now there in the Behçet, what is going to happen? There is a immune complex vasculitis. Means what? The immune complex are going to deposit in the vessel, and it is causing the vasculitis associated with HLA-B51. There is a aphthous ulcer, there is genital ulcer, there will be the uveitis, and there will be the erythema nodosum. There will be the, like you can see here, oral ulcer, genital ulcer, uveitis, and there is a, this is autoimmune, right? So systemic vasculitis, bloody diarrhea can also see, and this is precipitated by the HCV and parvovirus infection, and which is going to flare in 1 to 4 weeks. And this is again a immune complex vasculitis. It is very important Behçet. You have to remember this HLA association and this symptom. Now the cutaneous small vessel vasculitis, this is the superficial kind of vasculitis. There is no visceral involvement. This is a cutaneous small vessel vasculitis. Here the leukocytoclastic vasculitis occurs. This is a typical image of leukocytoclastic vasculitis, which can lead to a systemic vasculitis. Okay, and this cutaneous small vessel vasculitis usually occurred after the exposure to the certain medication and certain infection. In the medication, like the medicine like penicillin, cephalosporin, allopurinol, sulfonamide, and phenidone, and the infection like HCV and HIV. After exposure to this infection, after the 7 to 10 days, we can observe, or we can get the cutaneous small vessel vasculitis. Now this is about the cutaneous. Now next type is eosinophilic granulomatosis. Okay, this eosinophilic granulomatosis, there is eosinophilia, there is a granulomatous necrotizing vasculitis with eosinophilia. Again eosinophilia, that's why IgE levels are increased, and this is again a PNK positive. We have to remember this is a PNK positive. You can see here a typical image of necrotizing vasculitis with eosinophilia. These are the eosinophilia, and these are eosinophilia are stained with PNK positive. PNK positive, and there is the symptoms like asthma, sinusitis, skin purpura, peripheral neuropathy, and due to which there is a hand drop and foot drop occurs. Now this is ECG, E for eosinophilic, C for churg, and G for Churg. That is eosinophilic granulomatosis is also called as a Churg-Strauss syndrome. This is ECG with P wave. That is it is a PNK positive. Okay. Now there is also mnemonic like growth hormone. That is the GHR. GHR, that is growth hormone. That is the involvement of the GI tract, involvement of the heart, and involvement of the kidney. And in the kidney we have a glomerulonephritis. Now this is, remember, ECG P wave, that is about the eosinophilic granulomatosis or Churg-Strauss syndrome. Okay. Now next one is granulomatosis with polyangiitis. There are two types of granulomatosis. One is granulomatosis with polyangiitis, and next one is your माइक्रोस्कोपिक पॉलीएंजाइटिस. द पॉलीएंजाइटिस के दो टाइप है, ग्रैनुलोमेटोसिस पॉलीएंजाइटिस एंड माइक्रोस्कोपिक पॉलीएंजाइटिस. I will tell you later. Now in the granulomatous with polyangiitis, this LR long range vehicle, that is the involvement of the lung and renal, that is the kidney. There is involvement of the lung and kidney. Now in the lung we have the symptom of the upper respiratory tract and lower respiratory tract. In the upper respiratory tract we have nasal septal perforation, chronic sinusitis, otitis media, mastoiditis. Okay. In the lower respiratory tract we have hemoptysis, cough, dyspnea, like these symptoms. And in the renal, that is long range vehicles, that is in the renal R, that is the post-immune glomerulonephritis, due to which there is a hematuria and red cell cast which stain a CNK positive, that is PR3 ANCA or CNK positive. You are LRC, long range car, that is the lung involvement, renal involvement, and CNK positive. Here is ECG with P wave, that is the eosinophilic granulomatosis, that is Churg-Strauss syndrome, and this is a PNK positive. So this is the point of differentiation we have to note here. This is a PNK positive, this is a CNK positive. Now in the skin we can see a purpura on the lower extremities. Now here is a triad of focal necrotizing vasculitis, granuloma in the lung. I have told you the lung and kidneys are mostly involved, so there is a granuloma in the lung, and for which we can do a chest x-ray, and on the chest x-ray you can see a large nodular densities. So there is a lung granuloma, and also upper airway granuloma. There is large nodular density and glomerulonephritis, due to which you can get hematuria and red cell cast. Now in the treatment you can start glucocorticoids or rituximab or cyclophosphamide. Okay, so this is about the CNK positive granulomatosis with polyangiitis. This is about PNK positive eosinophilic granulomatosis. You have to remember this triad I have made separately later in the video. Now next one is your immunoglobulin A vasculitis. Okay, this immunoglobulin A vasculitis is also called as a Henoch-Schönlein purpura. In this we have major problem or major symptom or major finding is palpable purpura on the buttock and leg. This will be the key point or key lines in your question, that is the palpable purpura on the buttock and legs. There is a triad of arthralgia which causes joint pain or hinge pain. There is a abdominal pain is also with intussusception. Now you are knowing that intussusception is most common in the child. That's why this immunoglobulin A vasculitis is also most common in the child. This is a childhood systemic vasculitis and which occur after the upper respiratory tract infection. Okay, it is called as a Henoch-Schönlein purpura. This is a immunoglobulin A. It is secondary to the IgA deposition. IgA nephropathy, Berger disease. Berger disease is also called as a IgA nephropathy. After the IgA deposition, this is going to happen. That's why it is secondary to the IgA deposition, and it is Henoch-Schönlein purpura. The main finding is this palpable purpura on the buttock and leg. For this you can give supportive care and glucocorticoid. Okay, now the next is your MPA, that is I have told you polyangiitis had two types, microscopic polyangiitis or granulomatosis with polyangiitis. This granulomatosis with polyangiitis is a LRC, that is CNK positive. Okay, but this microscopic polyangiitis, in name itself P, that is it is a PNK positive. There is a necrotizing vasculitis here, and here also a lung is involved. There is a post-immune glomerulonephritis, and on the skin you can see a palpable purpura. Okay, it is the same like a granulomatosis with polyangiitis without upper respiratory tract involvement. Here is you can see both upper respiratory and lower respiratory tract are involved, but here only lower respiratory tract is involved, upper respiratory tract is spared. Otherwise all symptoms are almost same, and that's why there is no granuloma. That's why not here is a granuloma. Okay, you can see a, already told you, granuloma in the lung and upper airway. Here upper airway is not involved, so there is no granuloma, and no granuloma, there is no, that's why there is only microscopic polyangiitis. Here is granuloma, that's why granulomatosis with polyangiitis. This is main difference. I will tell you later also. Now here is PNK positive, that is AMPO onka or PNK positive. Again treatment is cyclophosphamide and glucocorticoids. Okay, now last one is your mixed cryoglobulinemia. Mixed cryoglobulinemia is mainly due to the viral HCV infection, and here is also triad of palpable purpura, weakness and arthralgia. Here is also a peripheral neuropathy, and renal involvement causes a glomerulonephritis. So this is about all the types of vasculitis. Now I will told you in short, that is you how you to remember. Now see here in the pan, that is the polyangiitis, sorry, in the pan, that is your this pan, polyarteritis nodosa. In the pan we have, pan means what, all the vessels are involved, all the vessels are involved except pulmonary artery. This you have to remember. pan name में ही है, all vessels involved except pulmonary artery. Now we have polyangiitis. Polyangiitis, there are two types in which the granuloma is going to form, that's why that is granulomatosis with polyangiitis. One in which granuloma, there is no granuloma, here is granuloma, you can see granuloma, and here is no granuloma. Okay, here the upper plus lower respiratory tract is going to involve, and this is a CNK positive. I have told you long range car, that is the lung involvement, renal involvement, and this is the CNK positive. This microscopic polyangiitis, which is a no granuloma and in which only lower respiratory tract is going to involve, and this is a PNK positive. You have to remember these points. Okay, now next there is two immunoglobulin related diseases like IgE, that is called as a eosinophilic granulomatosis or Church-Strauss syndrome, and IgA, that is a immunoglobulin A vasculitis, that is your Henosclein purpura. Now in the Church-Strauss syndrome we have a triad. In the Henosclein purpura also we have triad, and in the mixed cryoglobulinemia we have also the triad. Now we will see what are these triad. In the Church-Strauss syndrome we have vasculitis, lung granuloma and nephritis. Okay, in the immunoglobulin A vasculitis, that is Henosclein purpura, we have triad of abdominal pain that is associated with intussusception, arthralgia and purpura. And in the mixed cryoglobulinemia we have also weakness, arthralgia and purpura. So these are the triad we have to remember very thoroughly. Now abdominal pain, this immunoglobulin A vasculitis is mostly seen in the children, right? Now in the abdominal pain, the pan, Buscopan, for the abdominal pain we take a Buscopan. That's why there is in the pan, that is your polyarteritis nodosa, there is involvement of abdominal pain. In the immuno A vasculitis, this immuno A vasculitis is going to involve or affect mostly the child, and child always eats something and complain of abdominal pain. We have to remember like this way. Now nephritis is seen in eosinophilic granulomatosis. Now MPA, that is microscopic polyangiitis, and your mixed cryoglobulinemia. Now aneurysm, this is very important. The aortic aneurysm is going to seen in the Takayasu arteritis. Coronary artery aneurysm is going to seen in Kawasaki disease, and renal artery aneurysm is seen in the PAN. Now palpebral purpura is mostly characteristic feature, this seen in the other also, but it is most characteristic feature of the IgA vasculitis, that is your venous skin purpura, that is the palpebral purpura and the buttock and thigh. Now in these three also seen along with other finding, but it is most common finding related to the venous skin purpura. So in the MCQ, if there is a palpebral purpura, go with venous skin purpura or IgA vasculitis. Also seen in the MPA, also seen in the granulomatosis with polyangiitis, also seen in mixed cryoglobulinemia. Now the CNK is positive with the granulomatosis with polyangiitis. Okay, and PNK is positive in the MPA, that is the main PNK positive, and also eosinophilic granulomatosis. Now arthralgia is also seen in IgA, that is your child again. Child wander here and there and again complain of the leg pain or like that, we have to remember. And in the mixed cryoglobulinemia, mix means all there is a mixture, that's why arthralgia is going to seen. Now this is all about your vasculitis. I have made it in the tabular format. I have arranged all these images here. I will assure that the question in the NeetPG also or INI-CET or fmge, which will be asked in pathology and medicine from the vasculitis, will all this from this data. I have arranged all this data. There is no single point miss from me by the from the vasculitis. So remember this only, make chart of this and stick on your wall and remember this. Thank you.